The University of Colorado has a strong tradition in the care of liver disease patients. And this is the center that was the first in the world to actually perform liver transplantation back in 1963. Well, our mission statement is pretty clear. I mean, it's provision of the best in clinical care, exploring new therapies and new modes of disease through research, and training the next generation of care providers for liver disease.
And this is a team effort. It's not one individual or surgical program or medical program. This is a campus program that everybody should be part of the program, including the hospital administration. Because of the team effort and because we talk to each other a lot, people feel that this program is part of their life. I think this has a major impact on people's decisions to stay in Colorado. In addition, Colorado is a great state. It's a beautiful place to live.
We built it as a comprehensive program, not just transplant, but also treatment of viral hepatitis, treatment of autoimmune disease, treatment of liver malignancies, treatment of biliary tract diseases. We've been integrally involved through the entire spectrum of the treatment of hepatitis C. Back where we had almost no treatment that had any major positive benefit. And now we're talking about cure rates with current therapy for hepatitis C exceeding 80–90%. And we've been a part of that whole process of the clinical trials and the clinical care of patients with hepatitis C.
The liver transplant program at our center is 50 years old. And since then, we've had a very strong record with outstanding outcomes after liver transplant. We've also been at the cutting edge of developing new therapies for hepatitis C. This is probably the strongest immunology program across the board in the country. And so my ability to work with clinicians taking care of patients with advanced liver disease, manage them after transplant, and then also being able to work with other scientists, both human immunologists and even basic science immunologists, to try to get to answers, I think, is what makes us so appealing. Our focus is to establish cohorts of patients with different diseases at different stages of diseases. We have over 60,000 specimens that we've collected. I've started collecting since 1999. In terms of milestones for our laboratory, I believe that the recognition and the further development of the concept that it's the multicellular immune response to hepatitis C that determines the outcome of infection. I think that's something that we've been really at the cutting edge.
We have a big team of physicians and professionals that take care of the patients here at the University of Colorado. Obviously, we have surgeons and hepatologists, but there are a large number of people that keep this program working, and that includes interventional radiologists, anesthesiologists, infectious disease doctors, advanced endoscopists, our pharmacists, our clinical coordinators, social workers. All these people together are what make this a team. Our hepatology group last year saw over 1,200 patients with hepatitis C. We evaluated and listed nearly 100 of those patients. We do anywhere from 80 to 100 transplants a year and have about 500 patients on our transplant list.
Whatever we do is around the patients and improve what we can provide them. So even when we start new procedures that were never done before, we carefully assess what we know, carefully assess what we did, and that's what helps us to make decisions for the future.
If you were to come here for a GI fellowship, and then if you would come here for a transplant hepatology fellowship, you would be working with world-class scientists, world-class researchers, world-class surgeons, in a very multidisciplinary environment. You would be in an environment that is constantly going to challenge you, it's constantly going to excite you, and it would be done in an environment of love and respect.
We were the program that started live donor liver transplant in the United States, adult-to-adult live donor liver transplant. Other milestones for the program include treatments of hepatitis B, endoscopic management of biliary tract disease, including post-transplant complications. We have a tremendous group in interventional radiology that we work with on vascular issues. And another milestone is the evolution of non-invasive methods to measure liver function.
Our view for the transplant program for liver transplant in particular is to continue to grow the program to make sure that every possible potential organ is being salvaged so that it can be transplanted to save a patient's life. You know, to kind of continue to do the research so that the living donor program can become even larger and more successful.
When you see what happens when you cure someone with a chronic disease, cure them, I mean cure them of their viral hepatitis, it's a transformation. And there are so many chronic diseases that we just kind of manage and milk along. But here, when you achieve those cures, when you achieve those dramatic changes, like someone who's dying of end-stage liver disease, who's now alive, back to work and with their family, why wouldn't you do it?